a lot of things have changed. And I think that speaks for everything. Specifically, I've noticed a change in the habits of nicotine consumption at the beginning of the pandemic and currently. How have you seen a change and in your point of view?
I'm interested in actually, if you don't mind, in hearing how you've seen it change, because from the standpoint of an adult and a doctor in a clinical setting, it can be a very small lens. I'd love to hear what you're seeing too. Is that okay if you tell me?
Personally, for me, I've seen there's definitely been the shifts in the products used. I remember at the beginning of the pandemic, Juuls, early 2020, 2019, Juuls are very popular. Now Flume is everywhere. I've also noticed that there's become a decrease in the popularity of vaping a little bit. In the past, in before the pandemic, when I was earlier in high school, you would see people just vape with their friends because vaping was cool. And now you tend to see people vape. They're not just doing it because vaping is cool. You're seeing them use other types of substances now, but vaping's kind of lost its novelty.
You guys are more likely to see what is the shifts in brands and how things are being marketed. You're probably seeing that earlier than we are as adults because you've got friends or classmates or schoolmates bringing stuff in. Agree with you. I've seen that shift away from Juul and towards other things like puff bars. I think Julian mentioned that. And Flume, I've seen a couple times and heard about it a couple times as well. It seems like there's been a shift in what young people are using. It's interesting. We are 2 years later now, and there has been a lot more emphasis on getting information out to young people about the effects of vaping and industries behind them and tactics and strategies they use to get young people to use and to get addicted. I think it's been interesting to kind of see young people are smart. If they have access to information that is accurate, they get to make their own decisions. Most people will be like, oh yeah, why would I do that? I think young people have really heard what's going on and made decisions that has led to less use. I think that's what I've been seeing. So I'm glad to hear that that's what you've seen as well. The last thing I'd say, a lot of my patients were telling me it was a lot harder to vape when they're stuck at home 24 hours a day. It's not true for everybody, but if you're in a smaller apartment or house and you've got 5 or 10 family members living with you, you may not have as much privacy or opportunity to vape or have the opportunity to get vapes from a friend or from the corner market. I did hear that for some people, that was from a vaping standpoint, getting access was more difficult. And then finally, your point about addiction, I think it has been interesting for me to watch young people who were vaping before because they thought it was cool or because it had the flavors or whatever the reason was, to watch them go from thinking, well, I can stop whenever I want, to going on lockdown and realizing, oh my gosh, I can stop, I can be forced to stop, but when I stop, I feel horrible. I feel stressed. My brain isn't working right. All of these things that are associated with addiction and withdrawal, that became real for some of our patients. Whereas before, they could say, oh, I could quit whenever, I just don't want to. And because they didn't want to, and they actually didn't physically and psychologically feel what withdrawal from a substance you're addicted to could feel like. Those are kind of my sense of what's going on. It's not based on data, Elias. And it's sort of based on what I'm seeing from our patient population, but I am happy to hear that it's sort of similar to what you're seeing on your end.
It's not just I'm seeing a decrease in vaping and vaping nicotine. I've seen an increase in vaping cannabis. There's brands like Stizzy, dab pens are super popular, but there's also just become like a puff bar type cannabis model. Everybody has it. There are different brands. How do you think that has affected, and where do you see the reliance on cannabis in vaping form?
I mean, I agree. I think I'm hearing more about it from the young people that we see. I can't tell you exactly why that's happening, and that's part of what the Reach Lab is looking into. One element that I'm hearing about and have heard about for the last year and a half or so, the pandemic has really taken a lot of our control over our lives and experiences away from us. Whereas before, I'm going to go to school today, or I'm going to go to work today. Here's what I'm going to see. Here's what I'm going to do. And that's what I'm going to do afterwards. And all these things that we could make choices about and decide to do and not to do. Much of that was taken away when the pandemic hit. And then I think a lot of young people have felt it was just affecting them, or they felt alone in dealing with that loss of control and autonomy. What I'm referring to is for a lot of people, there's an element of anxiety that came into their lives. When the world seems out of control and your daily life is constrained or not as free as it was before and things like that, it can lead to anxiety. It can lead to trying to find ways to get control in your life. And I don't mean to get off the topic of cannabis, but we have seen as adolescent health providers an increase in eating disorders, for example. And at first it was very confusing. It was like, why would eating disorders increase? And we're beginning to see that it probably has to do with the uncertainty that's surrounding us on a daily basis for the last 2 years. The only things that some young people feel like they can control is their own bodies and what's going in, or, that sort of thing. And so eating disorders sometimes are a way of controlling the one thing that you can control. I'm not saying that's healthy. I'm just saying that that's sort of what we're beginning to see. On the cannabis side, what I'd say is that for a lot of our young people and patients that we've been seeing, using cannabis is the one way to kind of control these feelings of lack of control or control the anxiety in a reliable way in the short term. That doesn't mean I'm suggesting this is a good idea or that it is healthy, either physically or psychologically. That is one of the reasons that a lot of the young people I see tell me that they're either smoking cannabis, marijuana, or vaping it. As health professionals, when I see patients and when I talk to young people, is really to kind of help focus on what are other ways that we can deal with our emotions and our anxieties that don't put our physical and mental health at risk and that are much more long-term. There are things that you can use for the rest of your life. There are strategies that you can use for the rest of your life to manage stress and the feeling of being out of control or the feelings of anxiety that might happen, not just for young people, happens for all of us at all sorts of ages. Giving yourself these sort of gifts of finding other ways of dealing with those emotions and those feelings that don't have negative consequences for your health like cannabis can. I will say, and you guys know this, but I want to say you mentioned addiction or reliance on cannabis and the chemicals in it that give you the feelings that people use it for is not a particularly addictive substance. It is one that is very attractive, and that falling back on it might be a better way of describing people's use of it. About 10% of people who use cannabis a lot will get addicted, which is fairly low compared to nicotine, which is, the most addictive drug on earth for human brains. I worry less about addiction. I do worry about reliance because it's easy to fall back on it when things get rough or when you're feeling bad. In the end, it doesn't really help you grow in the long term, be healthy and remain healthy.
Can you summarize the specific feelings that the pandemic may be inspiring that could be triggering more of these cannabis and nicotine consumptions?
What we're hearing is definitely this feeling of lack of control in a world that feels totally out of control, which fortunately I don't think it is. But I mean, it definitely can feel that way. And it definitely felt that way for a long time in the early parts of the pandemic, although I think we're coming closer to a better place as most pandemics do. But those feelings are very real and can have consequences. So feeling out of control, feeling anxious. There are a population of young people that being at home with other family members can be really stressful, sometimes unsafe. Fortunately, this isn't a majority of young people, but depending on what's happening within your family, whether there's mental health problems in a parent or in your family sort of fighting, or if there's violence or if there's substance use within the family, these are all stressful experiences for anybody, but definitely for young people. And for those who actually getting out of the house and going to school or going to sports or going to work or hanging out with friends was a way of sense of comfort away from those stressors, that kind of went away when you're stuck at home. And so for some young people, that stress of being in a hostile environment, and maybe one way of putting it, or a stressful environment, that had real effects. I think a combination of loss of control, anxiety about a world that seems out of control, and then for some people being forced to be around some really hard situations at home and not being able to get away from it. And again, our goals should always be get the positive resources they need to stay healthy and to deal with the hard things in their lives, as opposed to some of the other strategies.
I think we want to talk about lockdown number one. How did lockdown number one change the way us young people acted and felt towards ourselves and others?
There's a fair amount of research that shows that the more screen time young people have, the higher the risks of depression and other mental health concerns. So I definitely agree that that is a problem. The one thing that I think about most in that area is that young people, a big part of development as a human being during the time of what we call adolescence, which kind of includes all of those from age 12 or so till age 25 or so, a big part of that is getting out there, having experiences with other people, pushing yourself physically, academically, emotionally, psychologically, spiritually, and figuring out who you are and what you're capable of doing. These experiences you have on a day-to-day basis help us to become the people that we are and to figure ourselves out and to figure out what we're good at, what we may need help with, what kind of people we want to be, to practice being different types of people. I'm outgoing today. How did that go? Or today, I'm just not going to talk to, you get to experiment with things and being different types of people and which one sticks for you. All of that stuff, all of that really important work was stopped when you were stuck at home. And that has a really big impact on people's sense of self, a really big impact on their development as people. That doesn't mean we're going to have a generation of like people who don't know who they are and are depressed all the time. It just means that for the last year and a half to 2 years, we've been really hard on young people like yourselves, because you haven't had the chance to feel good about if you joined a team and you never thought you would join a sports team, but they took you in and you started out and you sucked. But then you practiced and you practiced and you practiced and you got better. Like those are all experiences that contribute to who we are and our sense of ourselves and all that stuff. And when that's taken away, it can have a really hard impact on people while it's happening. Now, fortunately, when schools opened up again and young people went back to school and kids went back to school, I think a lot of those experiences started happening again.
The new variant has definitely caused a lot of new changes in the school place, in the workplace, and also substance abuse in adolescents. And for our final question, we wanted to know, what would you say is the best way to stay safe from the Omicron variant, especially during these times where it's definitely been spiking up and there have been a lot of absences in school and also work, and how we can work around that and keep ourselves and our friends and family safe?
I mean, that's a great question. And I think the most basic answer, is one that probably would have been a good answer 2 years ago, but we just didn't have a combination of the right information or the right tools. The best answer is find the best mask you can find, the highest quality mask you can find, and wear it well when you're around people indoors, sometimes outdoors. Because the Omicron variant, the public didn't hear enough about in the beginning of the pandemic was that this is a virus that's transmitted through the air more than anything else. I mean, we were wiping surfaces down and all this stuff, and that's all great, but a huge majority of people were getting this through breathing particles in the air. I think if we had known that, and I think if we had had access to good masks, even early on, it would have made a huge difference. But that early virus was a lot less contagious than Omicron is. What we know is that Omicron hangs out in the air maybe a little bit longer, or maybe it's just hanging out the same amount as the other virus. It's so much more contagious. And by that, I mean, let's say you had to inhale, I'm making this up, 10,000 viruses to get sick. And now you might have to just inhale 1,000 viruses to get sick. And there is easily 1,000 viruses. Like if you walk into an elevator or a bathroom or whatever, you might inhale that much pretty easily. So the point of it is not to freak you out. The point is that we know that we can still prevent it, and wearing masks that are at least KN95 masks, which are the kind of consumer level N95s that hopefully stick really well around your nose, don't let air come in around it or go out around it. In some cases, if you're in very high transmission areas like hospitals, or if you're in a gym, which I hope you're not in right now, or places where there's just a lot of people and they're breathing hard, those are the places where you want the strongest mask possible. So N95s. Cloth masks, I would stay away from. They just don't work for a virus that's this contagious. And surgical masks are way better than cloth masks because they have certain properties that attract particles to them, but they don't fit as well as KN95s and N95s. So really you want a well-fitting mask that filters well in the KN95 to 95 range.